Regurgitation is extremely common, and I would probably say every child or every infant would regurgitate once or even more times per day. So the key thing is actually to reassure the parent that that's actually a normal occurrence. And part of the assessment is to see whether or not the regurgitation is anything more serious. So generally, if the child's throwing up a couple of times a day, feeding quite well, quite happy, then I reassure the parent that I would consider the child a happy spitter. And if the child's a happy spitter, there's really nothing else one would need to do other than just reassure the parents and monitor. In terms of monitoring, what are the key things to monitor would be the general well-being of the infant. Is the infant happy? Is the infant putting on weight well? So if these are all present, there's really no need to actually do any test investigations or intervene. I would say it's probably almost 100%. I mean, almost all infants at some point in the first month or 2 months of life would be regurgitating. In terms of what percentage would be significant enough to then seek medical attention, it would probably be 1 in 5 or 20 to 30% of these infants. And what percentage of infants would be so serious as to require maybe specialist input, they were probably looking at much lower, like a 5 or 10% of that total. So regurgitation is actually part of a normal developmental process, mainly because the angle of the esophagus, the food pipe with the stomach, is a little bit wider or obtuse in an infant, so it makes it mechanically easier for milk to be regurgitated out. So it's both a mechanical disadvantage for the infant, plus the fact that the infant's taking predominantly a liquid diet. So there are a couple of things that will help in terms of the junction becoming more acute as the infant grows older, the fact that there's a muscle around that junction. And of course, as the infant gets older, they take solids, and the solids are a bit more dense and therefore less easy to be regurgitated out. So there are a couple of factors that make it easier for a young infant to regurgitate, and as the infant grows older, it becomes harder. Well, I suppose the key thing is how the child is vomiting or regurgitating. So a lot of times if the milk just dribbles out, or if the milk comes out with a burp, that's actually quite common. Parents tend to get a little bit more anxious if it's a real vomit. That means it's a bit more projectile, or if the child looks in some pain and discomfort. So I think parents tend to worry more if it's very frequent, or parents tend to worry more if the child looks distressed. Yes, definitely there would be some contribution, because what predisposes to reflux or regurgitation sometimes is presence of trapped air in the stomach, and when the air is burped out, a little bit of milk will naturally come out with it. So obviously an infant who is sucking very quickly, so probably this occurs more with bottle-fed infants rather than breastfed infants, that if they're sucking a lot of air, if they don't latch on well, they don't do a good seal on the teat, it's a possibility that a lot of air is sucked in at the same time. If the child's quite distressed and cries a lot during feeding, then a lot of air is swallowed at the same time. So you're right, some of feeding practices can predispose to some of these complaints.